As a women health specialist, the main symptom that the patient come with is sexual dysfunction, and that would include painful intercourse, a lack of vaginal lubrication, and lack of desire or libido. The second thing, which is another very important or major, let's say, symptom, is urinary incontinence or urinary dysfunction, and that would include recurrent UTI and painful urination, frequency of urination, nocturia, which is waking up during the nighttime to pee, and at the meantime, when you cough or sneeze, you get the leak of urine. It should be a combination, actually. It's not only one option. It should be a combination of options or treatments that would bring you to the optimal result that you are aiming for. I always start with the simple, treatment, and I always counsel my patient in regard to use all of them so they would get the best result. For example, for whatever the problem, whether it is a sexual dysfunction, vaginal dryness, or urinary incontinence, especially with the urinary incontinence, let's say Kegels is to start with. Using the pelvic physio is another thing, and to make it even more optimal and to see a very good result, to use what we call a Plus90 Vultiva, which is something that we are fortunate to have it available in Canada. And it's really very helpful for a lot of my patients that I have treated them with. It's a non-invasive radio frequency vaginal rejuvenation, not painful at all to do treatment, and helps with bringing back the vaginal lubrication. It helps with treating the urinary incontinence, and it helps with decreasing the UTI ones, because when you increase the lubrication, you get rid of the recurrent UTI, especially in menopause, and itching and irritation, and it helps to decrease the treatment needed for lichen sclerosis. It is very helpful for the patients who are suffering from the lack of desire or having painful intercourse. Okay, so I got really very good feedback for the patient who I did treatment for different reasons. So for example, for the patient I have targeted for lichen sclerosis, she noticed that she has significantly decreased the flare-up, and she is very comfortable, and she has no any trouble with sexual intercourse anymore. For the patient who have urinary incontinence, she started to have less frequency, and she doesn't need to wake up during the nighttime to pass urine. She hasn't experienced any leaking when she was coughing or sneezing. And I did a treatment for a patient as well with a lack of libido and desire, and it has been improved so significantly. Also, I did it on a patient who is after menopause with some laxity on the labia, and that improved the laxity to the level that she was so surprised after even only one treatment session. We are very fortunate and lucky that we have it available at Revive Cosmetic Clinic in Waterloo, Ontario.